I would like to share some idea about guiding tube because I think it is one of the most misunderstood matter about acupuncture practice. We usually think guiding tube is something invented in modern days, like a stainless steel acupuncture and plastic needle handle. We usually consider that way, but that is a misunderstood fact. So let me show you how I do acupuncture with guiding tube and without guiding tube. Long time ago, I was young, I was arrogant. And look at the smile. I don't like the smile. So I'm not proud of myself when I do acupuncture, frankly. So can you tell the difference? Guiding tube and without guiding tube. Using guiding tube and not using guiding tube makes no difference to me. Applying acupuncture without using guiding tube, I'm telling you, I can do that very easily. I have been doing acupuncture about 30 years and I have seeing the patient, 100 patients a day, and I have a specialty in acupuncture in Korea. So I think I'm entitled to say about this, without tube or with tube. Guiding tube was invented by Japanese acupuncturist Sugiyama Waichi in early 17th century. Early 17th century. Let me tell you about 17th century. 17th century, early 17th century is 200 years before Wang Qinren. Wang Qinren wrote Ilin Gaicho in 1830. So 200 years before Wang Qinren, acupuncture guiding tube was invented. And it is around the time when Zhenju Dacheng, Encyclopedia of Acupuncture and Moxibustion, was published. And in Korea, Dongyibogam was published. So guiding tube was invented earlier than we usually assume. Sugiyama Waichi is called father of Japanese acupuncture, Japanese style acupuncture. And he was trying to learn acupuncture from very renowned acupuncturist in Edo, nowadays Tokyo. But he was kicked out from that apprenticeship because they thought he's just dumb to learn acupuncture. So he couldn't go back to hometown because it was so shameful, not going back home, not doing apprenticeship. One day, he discovered that he was pricked by acupuncture needle, but it was not painful. And he tried to find out, and he found out that the tree leaf, was working like a guiding tube. So he started the shinkan in Japanese, or insertion tube, or guiding tube. Even Europeans, they introduced acupuncture with this insertion tube. So you can see here, this is from 1727, published in London, The History of Japan. There's an illustration of guiding tube and acupuncture. 1727. And first, stainless steel acupuncture needle was used in 1913 in the United States. And disposable needle was first started to use 1978. Comparing these two developments, like a stainless steel needle, guiding tube is kind of ancient, like Zhenju Daiching, early 17th century. Considering his age, I think it was invented around 1625, before then 1630. Somebody says, we need to apply acupuncture in authentic way. And guiding tube, they do not consider them as authentic way. I want to challenge that idea. What is traditional acupuncture needle? Do we actually need that? Somebody want to go back to the past? I think they would better use the needles from stones and animal bones. That was the start of acupuncture. We can say that is authentic. I think early 17th century is authentic enough. especially considering stainless steel is started in 20th century. And we do not challenge the idea of using stainless steel acupuncture needle. Then, in a practical point of view, we discussed in historical point of view. Let's talk about why we need a tube, insertion tube or guiding tube. Before, just not long time ago, just 30 years ago, maybe 20 years ago, all the masters I met in Korea, Japan, and China, they used their left hand to hold the needle body. Do you know that? They didn't use the guiding tube. Instead of that, they used their left hand fingers to hold that. It was not a fault at that time. We always used left hand to hold the needle body because we do not have such a meticulous concept of clean needle technique just 30 years ago. And needles got finer and flexible now compared to 100 years ago. Needles were way thicker and solid in old days. But nowadays, finer, flexible needle can make it easier to insert and less painful. This was a development. So in old days, like 100 years ago, doing acupuncture without guiding tube was easier. And needle can be bent easily without tube or left hand support. So that makes the problem with straight insertion. But sometimes needle bend easily, especially these days. And actually, my students do not care much about that. They just ignore that. They are not aware of bending of the needle. They do not care. Just put the needles. Let me show you how the experienced acupuncturists do acupuncture. She is a very famous acupuncturist, specialized in tongue acupuncture from Taiwan. SD36. So she's applying needle without guiding tube, even in CEU class. First, see how she locate the point and how she hold the needle with left hand and how she applied that kind of jerk, very fast snap. 3 factors. First, locate the point and hold the needle like a guiding tube and jerk, very fast snap. Just one more time. Did you find all these 3 steps? Finding the point, holding the needle, and a little bit of snap. Why do you think she give that kind of a jerk? To insert the needle fast. Without guiding tube, that fast snap is not that easy. So that is the part you need to practice. So needle should be inserted straight and fast, but guiding tube can handle that problem very easily. So holding the needle body and jerk, insertion of needle, penetrating skin, and progressing the needle. 2 steps are different. This is zhichen and this is zhenchen. This is penetrating of the skin and this one is progressing the needle under the skin. This is 2 different steps. So this is kind of preliminary work for actual insertion of a needle. So this actual insertion of a needle and this penetrating skin is a 2 different steps. We need a guiding tube for this one. And guiding tube make it way easier and less painful. This is the practical point of view. And buckling of the needle is an important issue. So thankfully there was a research from Chinese researcher, I assume, Zhang, a relationship between buckling of acupuncture needles and the handle type. I think it is a very interesting topic. So they made a device like this to assess the bending of the needles, and they tried different type of acupuncture needle handle. In many cases, if you observe the needling, the needle bent like this, that means your sword is shaky, wobbly. And they found out that coil handle is far more susceptible to buckling than needle with a plastic stick handle. So when you compare these 2 needles, this one is easier to bend compared to this one or this one. This one is still and rigid, solid. So this is the best acupuncture needle my favorite acupuncture needle. So the materials and devices matters, no matter how much you are experienced. Let's suppose I'm a sushi master. I can do cutting salmons without difficulties. Sometimes to show off, I can do that with a knife without handle. Can you imagine that? Knife without handle. I can do that because I'm too experienced. But do you want to be served the sushi which is made knife without handle? I don't think so. Think about it as a surgery. I'm a surgeon. I'm too skillful to use the handle of the scalpel. So I just do the surgery with those tiny, tiny little scalpel without handle. That doesn't make sense. So insertions of needle should be light and fast, like a jab in a boxing, light and fast. And progress of needle should be steady and slow, because we should be able to feel all the sensations of the needle tip transferred to us. I always tell my students that acupuncture is a conversation between you and your patient with those needles. So you need to be a good listener when you apply acupuncture. So how do you listen it? From the sensation of your needle tips. Please be a good listener. When you insert a needle, it should be very slow, but the insertion, 스친 should be light and fast. And acupuncture guiding tube will help you to that easily and correctly, precisely. There are some points we'd better not use guiding tube because guiding tube has some amount of thickness. So when I want to try the needle on intang, I want to do it right in the middle. But sometimes guiding tube let it inserted right beside of the middle line. How about here? 왼쪽, I want to do needle right in the crease, in a wrinkle when I hold it. So there's a very fine line. I want to insert the needle that fine line. Guiding tube sometimes prevent me from doing that precise insertion. In those cases, I apply acupuncture without guiding tube. But most of the time, using guiding tube is like a scalpel with a handle. Sometimes people think because guiding tube was imported China and Korea very later. So we think guiding tube is something from modern days, but that is not true. We consider that as a supporting wheel of the bike, cycle. So once you get used to cycle, you'd better dump them away because it is kind of burden. I insist that it is more closer to handle of the scalpel. If it is just supporting wheel of the cycle, why Japanese people using guiding tube? No matter how experienced they are, masters 400 years, why they are using that? Because it was useful. It was not a supporting wheel. The grandmasters in Japan, nowadays in Korea, China, they're using guiding tube. And especially in Japan, it has been 400 years. Using tube, here's my conclusion. Using tube is a courtesy to your patient because it will make less painful and make your acupuncture precise. It is not a matter of how much you experienced. Even grandmasters, they use guiding tube. Many of my students ask me, can I use guiding tube? And they just consider using guiding tube is a sign of inexperienced acupunctureship, but that is not true. Okay, we just discussed about guiding tube in historical point of view and practical point of view. There is a certain point using guiding tube and it can be beneficial for your patient. Why not? Please try to use guiding tube. Thank you very much. This was Dr. Choi.